There we are. Lovely. Fabulous. So yeah, croeso, that's welcome in Welsh to Swansea University. We're really, really pleased to have you here today. And the weather has stayed dry for us as well, which is nice. So you can really see the lovely surroundings that we're in. I've spoken to a couple of people already, but somebody's fairly local here, from Hertfordshire over here. Where else is everyone else from? So I know Llanelli as well. There we are, not bad, just over the bridge. What about yourselves? Graduate major. Oh, so again, not local, but not too far either. Nice, lovely. Oh, what about you guys? Oh, and a Welsh as well at the back then. Lovely.
I'm living in the marina now, but I moved from London back in January.
Oh, so you've been in Swansea for a few months now then?
Yeah. I work in Singleton Hospital as a maternity support worker.
Oh.
I'm interested in sort of like supporting people like bereavement and perinatal mental health.
Oh, brilliant! Yeah, very much.
I feel like this course might be the right one for me.
Yeah, very much needed.
They've said that they're not too sure, but I know that I want to go a little bit further into certain aspects of it.
So yeah, we'll talk about that a little bit in the presentation about what's good about this course and how it does really appeal, I think, to people that don't really know what they want to do. At the moment, and you get those options to really tailor the course to how you want it to be. So my name's Sarah Jones. I'm one of the lecturers here on the course. I'm not the programme director, so I'm not in charge of it. That's Jan Lewis. You'll see a picture of her later on. She's really the linchpin of our course, so she knows everything about everything. So if you do ask me any questions and I don't know, I can always ask Jan and contact you with the information later on. But I am one of the teachers on the course, so I know a fair bit about it. So just some of the reasons to study at Swansea. Where we are, it is really beautiful. We're very, very lucky to be positioned here on the seafront and by some beautiful nature spots, which we'll talk about in a bit. But about our university, we've got some really good statistics here. We're second in the UK for health professions courses. We hold 15th in the UK for student satisfaction. But that's at 131, so 15 is quite high. And we're 7th in the UK for health studies courses. And a little bit more again, so again, fourth in the UK for health studies. I've said all this on the same slide. But we've got 92% graduate outcomes. They're either graduates from our course are either in work, further study, or they're doing travelling, that kind of thing. But no one's leaving the course unemployed. We've got really good high levels of graduate outcomes there. Just a little bit about the faculty in general then. So we sit within the Faculty of Medicine, Health and Life Science. We've got lots of fantastic facilities here within the faculty. These tend to be more used by our professional clinical courses, but we do have these sorts of things available to us. And then within the Faculty of Medicine, Health and Life Science, we sit within the School of Health and Social Care. So you've got the faculty and then you've got 3 schools within it. You've got the School of Health and Social Care, the School of Medicine and the School of Psychology. So we're in the School of Health and Social Care, and these are the courses that sit within the school. So you've got this course here, the BSc in Health and Social Care, Healthcare Science, Paramedic Science and everything else that's up on the board there. We're the largest college in the university, the largest school in the university, and the largest provider of healthcare education in Wales. We asked our students just to do a little word cloud for us about what this course was about and what the course meant for them. And these are the kinds of topics that you cover when you're doing health and social care. So we talk about health, obviously, social care, but things like poverty, equality, social justice, health promotion, ethnicity, inequalities in health, disparities, class, immigration, discrimination, all of these things, which are really interesting, meaty topics that you'll get to, really think about and apply those then into jobs you go into in the future. So many of you have already said that you don't know what you want to do when you finish, you may have just come out of college or school, you might not have a strong idea about the career you want to take at the moment. So we see that as a really strong selling point of this course, really, that this course opens you up to many different options. So you don't have to box yourself into a job, like being a nurse or a paramedic, wonderful as they are. You don't have to be this one job. When you do this health and social care degree, you're opened up to many different opportunities. And these are the sorts of things that graduates from our course do. So we've had people go into civil service, they go and work in UK government, Welsh government and the council. Many people go into public services, things like criminal justice. We've had people go into working in the NHS, not as health professionals, but as like managers and leaders. People go to work in housing and social services. Voluntary organisations, we've had people go to work for charities, not as volunteers, but in paid positions, doing project management and community development. And we have had people go and actually create their own social enterprise and charities. Start their, they've seen a need within society, and they've actually been inspired to go and start their own social enterprise. People go into the private sector as well. Really you can do anything with this course because you get the transferable skills to go into into many different jobs that aren't necessarily strictly health and social. And then many people also go on to do further professional training. So once you've done this course, if it has inspired within you to be a nurse or a social worker, then you still have that option at the end. You can go and do a master's in nursing, pre-registration master's, or you can go on and you can do a pre-registration social work master's as well. And those masters will qualify you in those jobs. But people go on to be teachers, physicians, associates, midwives, all sorts. So those options are out there for you. Going back to nursing, some people do decide after year one of doing health and social that they actually do have a strong desire to do nursing. And we do, we allow students then at that point, if they do want to move on and go into nursing instead, that we can sort of arrange that. If you pass everything in year one, you can be offered a conditional offer to do nursing then after that. Having said that, you would have to go back to the first year of nursing. So you're not going to slip into year two of nursing because it's a professional course. If you complete year one of health and social, you can go into year one then of nursing. And then finally, you might want to do something like what I do. So you might want to come and do research, do a master's, a PhD, or become a lecturer. So just to give you a bit about my background, I'm a nurse. I've been a nurse for 14 years. I'm also a qualified health visitor. Hello. Come in. I'm a health visitor, so I work with children, young children and their families, supporting them. So yeah, my background's really in health. I then did a PhD in public health, which was all about infant feeding and childhood obesity. So that's kind of where my expertise and interest lies. And now I've moved on to teaching. So I've got a lot of sort of background knowledge to bring to you in regards to how the health system works, and the impact of health and social issues on people's health. So I've got a good understanding of that. But yeah, some people, I think one of my students actually has expressed to me that she wants to be a health and social care lecturer in the future, which is lovely to see that she wants to pass the knowledge on. Does that sound like the sorts of jobs that people are interested in the room? Yeah. And the possibilities, are endless really, because you can go out there and create your own, social enterprise or your own job, and you'll learn how to do that through the course, because we do have modules on social enterprise. Another example, we had a lady come to speak to our students the other day who works for Jigsaw Young Families Project in Swansea. They work with teenage mums and support them to, so this sounds very much like something you might be interested in. They work with teenage mums to support them in their parenting skills and things like that. She's a senior manager in that role in Swansea Council, but she started off doing health and social care. Okay, not here, because this course didn't exist when she did it. This was many years ago, but that's her background. She started off in health and social care and ended up going down that road. So a little bit how the course is run then. We teach, you'll have lectures, and we'll also do some small group work. So I'm a big fan of small group work. I don't like standing and just talking like I am now. I like to, we do little activities in groups. So it's quite interactive, okay? And we really discuss and debate the issues in health and social care. And you will have some one-to-ones as well with your personal tutor. So every student will have a personal tutor, and you'll be able to discuss your progress and your work with them. As I say, we like to be very interactive with our teaching. I do certainly. We do group works. We do things using sort of online polls and quizzes on our mobile phones, and try and get you involved like that, so you're not just sitting there listening to me talk. Because I can't talk for, well, I can talk for 2 hours straight, but I don't want to. Part of the course there is private study time. So as far as the timetable goes, you'll have about, I think it's about 6 to 8 hours of teaching a week. So it doesn't sound like a lot. You're only in for about 3 days. Is that about right, Tamsin? Maybe more, about 10 hours a week? Yeah. About 10, more like it, is it? Yeah. So you've got roughly about 3 days of teaching a week. We try and keep a couple of days free for you, and that's for private study time. So when you're in university, it's very different to college or school. You're not sitting there all day. You've got that time to go and read yourself, go to the library, make a start on your assignments, do the homeworks that the lecturers have set for you. And a lot of students like to get together in groups and work together on things that way. So you've got your private study time. Drop-in hours, the lecturers, we are available in our offices if you need us to come and see us. Obviously, we may be teaching, we may not always be there, but if you drop us an email, we'll make ourselves available for you. We don't do so much e-learning anymore because this, since COVID now, we have gone fully face-to-face. So we're back in the classroom all the time. But what we do sometimes have is some stuff online for students to complete as homework. So there might be discussion boards, some videos for you to watch, additional learning for you to do online, which is using our platform, which is called Canvas. So I don't know if you've used Canvas before in your colleges, but it's like Blackboard or Moodle. It's a way that you can log on and have a look at the classwork. Oh, it says there 13 to 15 hours content. Oh, so I was a bit low when I said 6 to 8, wasn't I? Can't remember how many they have now.
No, it tends to be, I know my timetable at the moment is mostly 2 hours for a couple of days. You might go one day being about 4 hours.
It does vary, doesn't it? You're going to have more some weeks than you have the others. So I think I'm thinking about certain weeks in the timetable and they've got a bit less. But yeah. The emphasis though in university is on that self-directed study. So you're not going to be totally left to your own devices. You will be given activities to do in that self-directed time. But it's not going to be you sitting in the classroom being talked at all day, every day. That's not university. The way we assess you then, because obviously when you come to university to learn, we also have to assess you to figure out if you have learned and for you to get your qualification. And we do that via quite a variety of methods. So you will have some essays. We also have quite a few oral presentations. Sometimes they're individual and sometimes they'll be in a group. So you'll be up there with a group of about 5 of you presenting together. Some group work, we have discussion forums. There are a couple of exams, not too many exams, and written reports. We understand that students have various preferences when it comes to assessment. So some students really don't like writing essays, but they're much happier standing up in front of people and doing a presentation, and vice versa. So we offer those different assessment methods to allow people to thrive and to do well in their various, in the ways that they learn and the ways that they prefer. I think the exams are...
It depends on the module. First year we have no exams.
There's no exams in the first year.
I taught health law and ethics, and we've got 3-hour exams.
You've got an exam for health law and ethics, there we are. So there's not that many exams, and there's none in the first year. I'm glad Tam's in here. She remembers better than I do. Does anyone feel a bit scared about the idea of doing presentations? Is everyone okay? Yeah. I mean, I used to be like that as well. I used to be so nervous. Oh my gosh, I could never thought I could do this and be a teacher. But you do get used to it, you know, and it is a really good skill to have to go off into the world of work with. You know, because in work you've got to talk to people, and you might have to talk to groups of people. So we do it in a really nurturing environment. So you're not going to be, you know, you'll know everyone there. Or sometimes we have had some students who want to do it on their own, just with the lecturers. They haven't got the whole class there. So we can accommodate that if needs, you know, if you feel really nervous. But would you say it gets easier, Tamsin?
I mean, you get used to your classmates, so it's not as nerve-wracking as when you first start. So yeah, it does get a lot easier. And I think there's only about 4-5 presentations anyway in the first year.
Yeah.
So it's not that many.
Yeah. Well, you say it's not that many, but it's sort of
over the course of the year.
It is, because it builds you up. So at first you might think, oh my gosh, but by the end of the first year you've done 5. You know, so you do feel much more confident with that then. And you know, you get to know your classmates. We are a nice small group, so yeah. Okay. So if you haven't already looked on the prospectus or on the website, I'll just quickly run through the modules that you do. So in year 1, you do 6 modules, and they're all compulsory modules. So there's no choices about what you do in year 1. So one of the first modules you do is poverty and plenty. So that's my module. I teach you that. And we delve into the issues of you know, poverty, societal inequalities, and how they affect people's health and how they affect people's social outcomes. So I find that really interesting. I do love teaching it. We talk about you know, politics. We talk about you know, stigma. We talk about the media and how it portrays people. You know, and we have some good debates in there. You know, we watch a couple of films, things like that, interesting films that are related to poverty, and sort of pick them apart and analyse them and understand them a little bit more. Dee, my colleague Dee, who we'll see a picture of in a minute, she teaches social enterprise and health and social care, because what we want you guys to be able to do is feel empowered to go make changes in your communities after you leave this course. You know, you don't have to feel as though you have to go into a particular job. You can go out there and create that job for yourselves. So it's about finding out what social problems exist and figuring out ways to solve those problems through developing a business plan or, you know, a charity idea. Equality, discrimination and oppression is another really interesting module. My colleague Mo teaches that. He's fairly new to our team. He's a lecturer from Nigeria, but he's just got some fantastic knowledge around this. And we have some really good debates there as well about you know, gender, race, disability, and all these things that that can adversely affect people and have done throughout history. So we talk about that. And then understanding social research. That's my module again. So you have that in the second semester of year 1, and it's really just giving you a basic grounding as to what is research and why is it really important to understand how to read research and how research is conducted in health and social care. Because in order to do a good job out there with people, we need to know what works and what doesn't work. You know, and I've done quite a few research projects myself, so I've got a good background knowledge to explain how research works to you. It can be a little bit daunting, but I can't emphasize the importance of it. We really need to have an evidence base for what we do. And then Jan runs a module as well. When you first start, straight away, in the beginning of year one, Jan runs a module developing your academic writing skills. So it's just that basic grounding again on how to write an essay, you know, how to write critically, how to reference your work and things like that. Things that might be new to many people coming into university level work. And D starts a module with you, starts you going with your employability as well. We really want our students to feel really well equipped to go out into the workforce after completing this course. So right the way threaded through the course is the employability stuff. And that surrounds helping you write CVs, helping you do, you know, interviews and things like that. And you have your anatomy and physiology course. Because this is a health and social care course, we really want you to have that health background as well, so you can understand diseases and how they work. And that's really good as well. Then later on, if you do decide to go into a health professional course, you've got that underpinning knowledge there as well. In year 2, you do 6 modules again, but this time you do get to choose some options. The first 4 there are mandatory, and then you've got the optional modules you can choose from as well. So you're doing a mandatory module in safeguarding children and vulnerable adults. You get, you do social research, which builds upon what I started in year 1. It's different teachers in year 2, but they're building upon your understanding of research. You do a module on reflective practice. This is so important. You know, when we're working out there with people, and as a nurse, I have had to do reflective practice right the way through. So we're thinking about our actions, thinking about what we do in our jobs, and seeing how we can improve. So often reflective practice is about an event that may have happened, you know, that perhaps didn't go so well, or you know that you went home and you were thinking about. Reflective practice is about formalizing that thought process. Okay, what happened? You know, how could I have acted differently? Why did I act the way I did? And how can we do things better in the future? So yeah, really important. And as a nurse, we have to do reflections every 3 years, written reflections, in order to continue our registration. And then health law and practice. So you have a module on that as well, so understanding the law and how that you know, influences our work. And then you get to choose your 2 optional modules. So you've got a choice of going on a placement module. You get a placement module again in year 3, I believe. It's not written down, but I'm pretty sure you get it in year 2 and year 3. So get a placement module, and Dee, who's our employability and our social enterprise lecturer, she's got loads of links out there with people, you know, organisations in the community, and she can sort out placements for you. So if you're interested in you know, social criminal justice, she can get you a placement in probation. You know, if you're interested in health, she can look into placements there. You know, check it in charities. You know, she can organise all of that. She's brilliant. And that's you go for 1 day a week for 10 weeks on placement, and you'll have the support there from Dee as well, right the way through. She's the module lead. You've got anatomy and physiology again in year 2 if you want to do it. So if you enjoyed it in year 1 and you feel like you want to go down more of a health path, you can do it again in year 2. You've got psychology of health and illness, which I think is really interesting. So this is all about why people behave in the way that they do. You know, why do people smoke? You know, how can we help them to stop? You know, because it's all up here, isn't it? A lot of it is why we do the things that we do. You do that module, don't you? Do you enjoy it?
It's literally my favourite out of the options this year.
Brilliant.
It's done by Darren as well. It's only 1 lecture a week, unfortunately, for 2 hours. And then you have a 4,000 word assignment in January. So he does a presentation as well, but it's not marked. It's just a 4,000 word essay.
Okay, so you have a formative presentation. So formative work is where we get you to do an assessment, but it's just to help you develop. It's not marked. Well, it is marked, but it's not. It doesn't go towards your grade. And then you do an essay as well for that one, is it? Yeah. The psychology of health and illness, I love it. I teach that in the masters as well, so I really like that. Sociology of health and illness, I really love that too. So that builds on poverty and plenty and equality, discrimination and oppression. So sociology of health and illness is more about what are the social factors that are affecting the way people behave. Okay, so if we think about smoking, you've got the psychological factors, why people do behaviours that they know are unhealthy, and then you've got the social factors. What is the wider influence of sort of like poverty, gender, race, all of these things on why people behave the way they do. You can do an optional module. Hello. Right. All right, yeah. Optional module there on domestic abuse as well, which is another one that students do find really, really interesting. And then social enterprise, again, building on the social enterprise module in year 1 if you enjoyed that. So you do have lots of options. The only thing I will say, we are quite a small cohort. So we have about 24 students. 24, well, at the moment this year we've got 24, I think, but it can go up to 40-ish. So we're quite a small cohort, which I think is a real benefit. It's fantastic because you all get to know each other really well. We get to know you really well. And, we're able to do these lovely group works, these discussions and everything. And it's quite a nice little cozy environment to be in. The downside to that is because if everyone chooses different options, we can't always run all the modules. So there can occasionally be the case where you've chosen an option year 2, but if only one person's chosen it, then we can't necessarily run it. But we do our best to run all the modules, as if we can. Then in year 3, then you do 5 modules. The mandatory modules are global perspectives and working in a globalized world. So sort of prior to year 3, we do focus much more on what's the situation here in the UK, what's the health and social issues here, the laws, the policies, the practice. But we bring in more of a global perspective in year 3 then. You do a module on management and leadership, because if you come out of university with a health and social care degree, you're expecting to go into more of a management role or a leadership role, like that person I said to you earlier who left and went to go in the NHS as a manager. That's the kind of jobs you'll be looking at when you, with this sort of degree. So management leadership, you need those skills to be able to do that. You do a dissertation, and that's a double module. So that's worth double the credits. So it's worth more marks for you towards your degree. And you can do it on whatever topic you want. So we've had students do their dissertations on, social media and anxiety, on cyberbullying, on, walking, the benefits of walking groups for new mothers or something like that, whatever you're interested in, you can do your dissertation topic on. So you'll have a supervisor working with you, you do the research and you write a big piece of work about, showing all the evidence for whatever it is you're interested in. And then you've got your optional modules again. So if you really like the health side and you did human anatomy and physiology in year 1 and year 2, you can go on and carry on and do pathology and therapeutics, which is much more about, pathology means disease and therapeutics, how we treat disease. If you like law, in year 2, you can carry on and do law and ethics again in year 3. And again, psychology weaves through. So if you enjoyed psychology, you can carry on. So Tamsin, you'd be pleased to know you can do psychology again in year 3. Counselling and supporting people, that sort of leads on from the reflective practice a little bit. They are different, but counselling. With that, it's more of an intro to counselling. So you won't be a qualified counsellor when you do that module, but it does give you some background to what counselling is and some skills to be able to talk to people effectively. You can do introduction to health and care economics. So kind of where does the money go? Everyone says the NHS is cash strapped, and it is, but how, how does it work? How much does it cost to treat diseases? And then social enterprise, again, if you really want to go out there and start your own business and make a change in the world yourself, you can continue to build on your social enterprise journey from before. So I hope you can see that we've sort of weaved the journey through for the different pathways that you might like to take. So if if you've got that health side, you can do the anatomy, physiology, psychology, sociology, whatever it is you enjoy, you can pick the modules and tailor the course to suit you. Anyone got any questions about the modules? People think they sound interesting? Any particular ones they like? Yeah, they are interesting. I know I'm biased because I'm one of the lecturers, but they really are. I love teaching this course. It's brilliant. Okay, so that's our team. So, like I said, we have a fairly small cohort of students, about between 24 and 40. And then this is our team, which is a fairly small team as well. So we do all get to know each other really well. So we've got Dee there at the top left. She is the employability and social enterprise lecturer. We've got Sophia. She teaches research in second year. Me, I teach, at the moment, I only teach in the first year. So I teach poverty and plenty and research. But who knows, things may change. Darren teaches psychology, and you really enjoy his lectures. Alex, she teaches sociology. Jan, she teaches lots of different stuff, and she's the program director, so she's in charge. Vivian teaches management and leadership. Alison, law and ethics. Mena, research, and Janet does counselling and reflective practice. And we should have Mo on there as well. Poor Mo has been left off. He teaches equality, discrimination, and oppression. So yeah, really nice bunch. And we like to think of ourselves as a really supportive team. We are, we do really care about our students. We know you all, even if you're not our personal students. We know you all, and you can approach any of us. Would you say that's the case? Yeah. I think particularly like me, Dee and Jan are kind of the kind of core team that we sort of know everyone. You're under pressure. You couldn't say no to that then, could you? Oh my goodness. Yeah. We do have a book, okay, that was written by our students. So Darren, our psychology lecturer, and Steph, who used to work for us, but she's left now. They wrote a book, Textbook Health and Social Care, because they found a gap in the market, really. There wasn't a book that was really tailored for a course such as ours. So they wrote this book, and it's like, it's got everything you need to know in it. You don't have to buy it. It is available in the library, but a lot of our students do have it, and they find it really useful. So that's really about the course. Now I'm going to move on now, talk just about Swansea University and things in general. Has anyone got any particular questions about the course itself? No? I do rabbit on, so if you think of anything, just say, or you can come back to me at the end and we can have a chat as well. All right, so just about the university then a bit more widely, we do have scholarships available for students. So just for you to be aware that if you do get AAA at A level or equivalent, you qualify for our excellent scholarship, which gives you £3,000. I think it's 1,000 per year though, so Cecilia's nodding. It's 1,000 per year. And the expectation though is, if you get the excellent scholarship, is that you attain 60% or more in your modules as well. So you have to continue to do well in university to be allowed to have that money. But it's really good, extra bit of cash if you're doing well. Same with the merit scholarship. You get AAB or equivalent A level, you get £2,000 extra cash. Again, you've got to continue to do well in university as well. There are income-related bursaries available, and that'll be the case, for any course. And if you speak Welsh, anyone Welsh fluent speaker here? Yeah, you have got the option to do the Welsh, medium Welsh provision, and you do get a bursary for that as well. I'm not sure how much it is, but you do get some extra money if you want to study in Welsh. Jan is a fluent Welsh speaker, so she can do your personal tutoring in Welsh. You can write your essays in Welsh, whatever, if that's what you wanted to do. We've got 2 students doing that in the current year. And then we've got other scholarships as well for international students. music scholarships, sports scholarships, and other things. So have a look on the website at the sorts of scholarships that are available if you think that you might meet any of those. There we are. It's a bit more about studying through the medium of Welsh. There we are. So you can get £300 to £1,000 per year for Welsh medium study. Do you think you'd like to do Welsh and do it in Welsh, or prefer not to? Either or, yeah. So we've got, I say, we've got a couple of students that are doing it, and, you know, they get the extra cash, so, you know, why not? It doesn't disadvantage you in any way, because, like I say, Jan can speak Welsh, and she'll mark all the work that's done in Welsh. And there's some more information about that between 11 and 2. So we've got some, as you know, I mentioned at the start, we've got some international students like live streaming us in. So, you know, we do have a really diverse student body. Cecilia is an international student, admissions officer, so she knows all about how many students we get from all around the world joining us, which is fantastic. And on our course, Health and Social Care, this year we've got 8 students from abroad, from various countries. So it's really nice for our, you know, home students and international students to meet each other and work together, you know, and learn, you know, about these subjects through the lens of different cultures, especially when we come to, I think, modules in the 3rd year, the globalised perspectives. I think that's really great to have that. We do pride ourselves on our sustainability as well, because of where we are. You know, we're in this area of outstanding natural beauty here in Swansea, or the Gower Peninsula. So we like to, you know, the university's got a strong sustainability record and plan for the future. So we're ranked 13th in the UK for our sustainability. We've got green flag status. The university, the student and staff do a beach clean. I think it's quite, I'm not sure when they do it, weekly or more often than that, but right there on the beach. So people, they do gather together and they go out and do the beach cleans. And we do have on campus a zero waste shop as well. So you can go and get your bits and pieces about additional plastic waste. Talked a bit more about the graduate prospects. We do really well generally as a university in terms of you know, what our students do when they leave. We become 6th in the UK for graduate prospects. Now this part I need to learn more about, because I don't know much about it, but we do have the Global Study Abroad option available for all students. This isn't just our health and social care. Across the university can do this, and there will be hopefully information available on it, because I don't know much.
Yeah, so there'll be funding available. So we don't have a year abroad at the moment for health and social care, but that's something that we're looking at. And when we're able to set it up, then we may be looking at extending your stay with us. And then in year 3, you choose one of our partner institutions overseas and then go and study for a year and experience what life's like overseas in a partner institution. Your fees will be reduced, and you'll also get a level funding as well from one of the government funded bodies, so to support some of your spending while you're overseas. But in the meantime, during the summer, there's a lot of 2 weeks work experience, internship overseas that you can apply for, and again, you get funding for those. So look out for those. And we've got somebody in my team who looks after study abroad and etc. So when you enroll with us, you'll hear from her, Lucy, and she'll tell you all about the opportunities.
Brilliant. There, I'm glad you're here to see it, because whenever this slide comes on, I go, oh, I don't know much about study abroad. Looks great though. Very jealous. Like to do that. Yeah, so just this is just about really kind of our student support that we have on offer here at Swansea. We've got lots and lots and lots of student support from kind of at our level, you know, at course level with your personal tutor. You've always got someone to speak to. And then we can then direct you to whatever other university support that there is out there for you. So we've got, you know, whatever religion or faith you have, we've got support for that. You know, international support, money support. We've got brilliant money support. So if anyone's struggling financially, we can direct you to them and they can see what they can do for you. Participation, we've got lots to do with, you know, you can participate in lots of societies and student unions. I think we'll come on to that later as well. And we have student welfare support, which, you know, we do recognise that when students come to university, it's a big life change for them, especially moving from away. You know, and we really want to provide that safety net underneath all of you, so you don't feel that, you know, you're doing this on your own. So we've got strong student welfare support there now for you. And the wellbeing service includes mental health support, you know, self-help resources, counselling, and we've got lots of support as well for people with autism or any other sort of special learning difficulties. So there's dyslexia, ADHD, all of these things. We've got help that could be put in place for you for that. With regards to learning needs, you know, we've got your personal tutor. If you disclose a learning need to the disability office, that'll be logged onto a system, and your personal tutor will be made aware of it, so they'll know the needs that you have in the classroom. So whether that means, you know, extra time for certain assessments, different marking strategy that we use when we're marking your work to take into account your learning needs. You know, we'll apply all of that because we'll know about it. So I think if you have got any particular needs like that, I really strongly urge you to let us know when you join, and let the disability team know, because there is lots of support out there for you. Got to talk about costs. We've got to talk about cost of living. Compared to the rest of the UK, Swansea's actually got a relatively low cost of living, which I think is quite attractive to students. So average weekly rent there is £145. Student bus pass for a month is £32. And, you know, we've got a gym here on, well, it's not here on campus, it's over the road, but it's part of our university. It's literally walking distance over the road, and that's £15 a month, which is really cheap for a gym, and it's great.
Just right on from the student bus pass, there is also a travel pass that you can get online, completely free. So when you move in, you can apply for it, but you have to use the address that you're using here. It comes in the post, and it discounts massively for the buses. So I'm living in private halls near the train station, so I get the bus to lectures. And for my year bus, my academic bus pass, I think I spent 270 quid instead of something like 400 quid, which massively helps as well.
Brilliant, that's good to know. There you go. We do guarantee accommodation for students that get a place here. So there are accommodation tours running today if you want to go and have a look at them. We have accommodation here on campus, which is really handy if you can get into those, because you can just roll out of bed and come to lectures, because all your lectures for health and social care will be on this campus. It's really nice, actually. You know, Swansea is one of the few campus-based universities in the UK. So we're all kind of, you know, here in this one place, and it's really nice and easy for students, especially when they're moving from away. We do have two campuses. So this is called Singleton Park campus, and then we've got Bay campus as well, which is sort of just on the road as you exit Swansea. So as I said, all health and social care lectures are here, and we do have accommodation here as well. Some students, if they've joined us a bit later and haven't been able to get accommodation here, they have accommodation on Bay campus, but then they can just travel in via bus. And then there are other student accommodations as well in the city centre, and some students prefer to use those because they're in the mix of things in the city centre, and then they prefer to travel in to the university. I think I'm missing some slides, because I'm sure I had some bit more about where we are in relation to other things. I think it's changed. Yeah, I think it's changed. Never mind. Talk about that in a minute. So for parents, you've got a few parents in the room and carers and so on, you know, we're happy to, you know, give you more information about your child going to university, and there's a newsletter that you can sign up to, you know, and if you go on the website there, swansea.ac.uk/parents, that's all kind of the information that's geared there towards parents for you. Tamsin, it's over to you. Has anyone? I didn't. I didn't. No, but what we have got Tamsin with us, so she's in her second year. She's been, you know, giving us some little bits of information as we go through. But she's really the best person to ask any questions. So if you've got any questions about the course, Tamsin, she's like living it.
I mean, I've lived on, if you have questions about accommodation as well, I have lived on campus and I am now living off campus as well, so I can give sort of a perspective on both, especially advice about the buses, because they are hectic.
What, busy?
Yeah. Like, best tip if you are living in the city centre and having to get the bus, either use the Santander bikes, so you don't even have to deal with buses. I think they're £3, but that's every half an hour, and it takes just under that, so it's about £2 on the Santander bikes.
The Santander bikes, those higher bikes that we got, you know, the little, they used to call the Boris bikes in London, you know what I mean? Where you can sort of pick them up from like a docking station and yeah, go back and forth on those.
If you are getting the bus, get the bus before the one that'll get you to your lecture on time, because less likely to have that many people on.
What about the course itself? Have you got anything you want to say about the course?
First year can really seem like, if you've got background knowledge, like I've been working with a charity organisation since I was about 16, it's been up to 5 years nearly working with it, so I have a very strong background before doing this course. So if you've also got that, it can seem very easy in your first year, but then you sort of get a shock when it comes to second year because it's all new stuff, but it sort of, as much as it shocks you, you get like support, you get many opportunities to talk to the lecturers. You've got your academic mentor, Sarah's mine. So you can talk to anybody, get the advice anywhere, because in second year, I think there's 18 of us now. We are really, really close as a group. We do tend to have like our own little groups, but we do try and meet, even if it's just for a drink, going out and talking about lessons, seeing how we are doing. The hardest thing is just starting your assessments on time. Don't leave it till the last minute.
I can't believe you just said that. That's like the best advice ever. Don't be excited. I'm just going for the students. Well done. No, you don't. You're very good. You're very good. You are very good. But yeah, many students do, you know, they enjoy the social life, which is that exactly what we want them to be doing. You know, it's not just about coming here to study and work, it's about making friends and having that new experience. But yeah, don't leave your essays to the light people. We do know. We can tell. But yeah, I know Tamsin was touching upon that yeah, in the first year we do, you know, you found it making it easy for you because you knew a lot of the information already, and if you've done so health and social care before, like some of you have in college or school, you know, you will have that background knowledge. But I see that as a real benefit, you know, because you're going to come in, you know, with a bit of a thing behind you already. But then for those of you that haven't got any background in knowledge of social care, we do start very much from the ground up. So either way, it's fine. So I think we're more or less at the end of the talk, I think. This is just some more activities for you for the day. So if you want to look at, you know, have a little look around the rest of the campus, have a look at the sports facilities over the road. Is anyone particularly sporty? Yeah, a bit. Yeah, so it's really good. Like the gym, I actually go there as well, because staff get a discount as well. And it's really cool because it's just over the road, I can fit it in before coming to work. So that's nice. And I get in there before the students because I go there early, they're in there later. So I got there at the same time as the students. Yes, we've got great sports facilities. We've got an Olympic-sized swimming pool, you know, athletics track, football field, all of that over there. It's massive. Have a look at the accommodation, go to the university's information hub, which you can find out more about all the wider university support that's available for students. There's a students' union. Really, you know, they've got a really strong voice here in the university. They do attend all the kind of high level management meetings at the university. The student voice is there right the way through. And I did mention earlier, but I think the slide's been taken out. We've got, you know, there's so many student societies. So if you, whatever you're interested in, I guarantee there'll be a student society that you can join and, you know, meet people, like-minded people. Like I had a girl on the current first years now that's just joined. She was worried about making friends. She spoke to me after class and I said, what are you into? And she said, I'm into K-pop. And I was like, right, there will be a K-pop society. Like, I guarantee you, there will be a K-pop society. That's really, so whatever you're into, like, there will be something for you. Yeah, to find out more about the global and stuff, because you know, we mentioned that, but see what they tell you about that. Got the Welsh speaker drop-in, if you want to have a look at that. Have a look at where we get food. There's lots of places to eat on campus. And developing the new catering in Fulton House at the moment. So there's going to be a brand new, probably by next year, I would have thought it'll be open, brand new catering facility there. And, you know, if you get the chance, if you come from away, please explore Swansea and the surrounding areas, because, you know, where we are is really one of the best things about, you know, aside from the fact that, you know, we're an excellent university, the teaching and all of that, we are in this stunning place. And when you get to come here to live, you know, many people do stay because they just really enjoy being close to the nature spots that we have. So we've got the Gower Peninsula, the beaches. Anyone into like water sports, surfing, things like that? Maybe might like to be. Yeah, so I'm a surfer and a paddleboarder, so I'm, you know, I love it. So we've got all of that on our doorstep. We've got places to go and walk, really beautiful around here. So yeah, that's definitely get a chance to have a look while it's not raining. There we are. I think that's it, is it? Can we go? Yeah, that's it. Any questions for me, or if you want to hang around, I can talk to you at the end. I've probably talked, you know, I've probably covered most questions you had, hopefully, but, you know, if there is anything else, you know, I'll wait around afterwards, and you can always email us as well. I'm more than happy to answer questions over email. Okay, thank you very much. Have a lovely rest of your day. Enjoy. Oh, thank you.